here to be my patient for the day. Let's see, we are doing her thorax and lung inspection exam. First of all, we're going to just look at her in her natural position that she's in and examine her respiratory quality and her chest symmetry and some of the other characteristics. Respirations are noted to be symmetrical in an upright sitting position. And she is relaxed, had a relaxed posture with her hands in her lap, and she's able to support her own weight. Her respirations are of an even depth, and there's no barrel chesting noted. She is alert and oriented ×3, and she appears to be in no acute distress. So, let's see. The next thing that we're going to also inspect is her thoracic landmarks. The shape and configuration of the chest wall. She has her spine process are noted to be in a straight line, and thorax is symmetrical and an elliptical shape. So, and it's downward sloping with the ribs about 45 degrees in relation to the spine. Also, that was our anterior. Posterior, just lean forward just a little bit. It's kind of hard to do in this chair, but also inspect the posterior spine. And if you take a deep breath for me, you notice that she is able to take a deep breath and expand her lungs. You can let it out, sorry. And she has no chest lag. It's her respirations are easy, regular, and even. She has no accessory muscle usage, and having pain with inspiration or expiration. So no complaints of pain. And her respirations are about 18 to 20 per minute. We're also going to notice the AP diameter. We are going to look at, raise your arm up for me, the transverse. And transverse should be equal, just using this ribbon as an illustration because it's hard to see, to the posterior, and it is. Okay. Let's see. And then we are going to do her finger test, the Shamrock test. We're going to put her fingers in this position, and you can clearly say that she does have a little bit of a window and some clubbing of her nail beds. She is a smoker, and you've been a smoker for what, 20 years or better?
Oh, more than that, probably about 40.
40 years. So she does have some evidence of clubbing. Okay. Watch out. Then we're going to start out by, you got the camera on, palpating the structures of the chest. And we're going to make sure that there's no nodules or any masses or depressions, any crepitus. Let's see, and also, let's see, we already did that. Make sure that just even respirations. Um, we're going to also, for the palpation, we're also going to inspect or palpate the scapula area and make sure that it is symmetrical within each hemothorax. The neck and the trapezius muscles are noted with normal development and some age-related changes, and you can see that she has a little bit of kyphosis. Let's see. I already did the thoracic inspection. Okay, and then so the tactile frenus.
6 minutes.
We'll palpate the, make sure that we find the midline of the trachea, and we're going to palpate the trachea and make sure that it is midline. You can see that she has no jugular vein distension on either side. And then we're going to do the tactile frenus. We're going to place our hands on her chest, and then I'll have you say 99.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. And then we'll do it again.
99.
Okay.
99. 99. 99.
Okay. And then we'll come around to the front, and then we'll do it again from the front.
99. 99. 99.
Okay.
99.
Okay. Good. All right. And let's see. Okay, that concludes this part of the segment, and we will continue with part 2.